My son often tells, Dad, I just don't get your medical talk. The words are impossible. Many joke that English as a language collapses under pressure in higher science books, leaving Greek and Latin languages to take over. Pure sciences borrow heavily from Greek, medicine thrives on Latin, and the fancier the food item, the more likely it is to be French. No wonder patient-doctor communication can feel like scaling the Mount Everest. Doctors and patients worldwide struggle with this, and the reason will blow your mind. Turns out Alexander the Great is to blame. 2,800 years of history led to this linguistic maze. When global fields don't follow unified rules, chaos ensues, and history is full of proof. In 1908, Olympic calendar mix-up. It's 1908, and the Olympic Games were meant to happen in Rome until Mount Vesuvius erupted, shifting the event to London. After 14 days, majority of medals were handed out, and then Russia's Olympic team arrived. Confused faces all around. Why the delay? Turns out they have been following their local calendar. Blissfully unaware, they were 2 weeks late. And then came 1999, bringing an even bigger disaster. The next part is even wilder. The lost satellite of 1999. NASA sent the Mars Climate Orbiter to the Red Planet at a cost of $327 million, designed to orbit and relay crucial weather updates to Earth. Sounds simple, right? Well, not quite. Such precision requires complex calculations, meticulous measurements, and absolute consistency. Here is where things went sideways. Some of the calculations were done in the United States, while others were tackled in the UK. The satellites were launched on 11 December 1998 with engineers from both sides of the pond working together, and then disaster struck. NASA's Jet Propulsion Laboratory, or JPL, used the metric system meters, millimeters, kilograms, while Lockheed Martin, NASA's contractor in UK, worked in imperial units, inches, foot, and pound. A simple miscommunication turned into an astronomical catastrophe. The probe vanished into space due to its unit conversion errors, causing a loss of hundreds of millions of dollars. This was not the first mistake of its kind, nor would it be the last. But if anyone truly grasped the importance of universal language, it was none other than Alexander the Great. A lesson for the ages. Alexander the Great. Alexander the Great lived for just 32 years, yet no other rulers before him had ever carved out such vast empire. His secret? One land, one language. From Greece in the west to India, Egypt, and Turkey in the east, his empire was a melting point of cultures, each with its own language, a logistic nightmare for governance. But Alexander was a scholar at heart, and he saw firsthand how intellectuals from different lands struggled to collaborate simply because they spoke different languages. So, alongside the territorial expansion, he championed linguistic unity, ushering the golden age of Greek language. Enter Koine Greek, the lingua franca of Hellenistic world, spreading Greek culture far and wide. Koine Greek was a dialect of Greek in Alexander's time. Under his rule, it became the common language for scholars and general public. Alexander's insatiable thirst for knowledge was shaped by none other than his legendary mentor, Aristotle. In Pergamon, modern-day Turkey, he established the second largest library in the ancient world, turning it into a beacon of art and culture. And what of the largest? The honor belonged to Alexandria, near present-day Cairo. The Library of Alexandria soon became the heart of scientific discovery, a place where knowledge flourished centuries before the printing press was even dreamt of. For perspective, the world's first printing press came along in 1440, thanks to Johannes Gutenberg in Germany, 1700 years after Alexander's era. The Alexandria we are talking about dates back to 331 BCE, home to a vast library of housing over 400,000 scrolls. But it was not just a library, it was a part of something even greater. The Museum, a research institute named after the Muses, the Greek goddess of inspiration. At its peak, Alexandria was the epicenter of global knowledge. Alexander, the visionary, threw open the doors to the scholars from across the world, offering generous scholarship and lucrative opportunities. Naturally, intellectuals flocked to his empire, eager to study and share their wisdom. But here is where things got tricky, especially for doctors and their patients. Most learning at Alexandria was conducted in Greek, meaning that when scholars spread across the world after learning, they took Greek language with them, shaping the way knowledge was passed down for generations. The ripple effect of one man's ambition started. Romans and British colonialism. A few centuries after Alexander the Great, the Roman Empire rose to dominance, spanning 1480 years, from 27 BCE until Constantinople's fall in 1453. And guess what their favorite language was? Greek. For centuries, scholars penned medical texts, conducted research, and built vast intellectual legacies, all with a strong Greek influence. Technical terms had to remain consistent across borders, and to this day, Greek and Latin shape much of the scientific terminologies. After all, a misspelled unit or mistranslation could result in multi-million-dollar satellite failures or delayed Olympic athletes. Greek was not just a language. It was the mother tongue of the Indo-European linguistic family, which later gave rise to English. The early Anglo-Saxons borrowed heavily from Latin and Greek, especially in medicine, science, and academia. Take biology for instance. It sounds like an English word, isn't it? Not quite. It comes from straight Greek. Bios means life, logos, study. Latin was Greek's linguistic sibling, gave birth to Spanish, French, Italian, and more. Yet, when it came to scientific and technological language, Greek remained indispensable. When the British expanded their empire, they carried Greek, Latin infused English medical science to India and beyond. Colonial rule introduced schools, colleges, and universities where students studied medicine in English. The result? Medical terminology never truly adopted to local languages and likely never will. The need for common medical language. Why? Because humanity speaks in many tongues, from Bengali in Kolkata to Swedish in Stockholm, Pashto in Afghanistan, and English in London. Imagine if each language had its own medical terminologies. Patients might understand their doctors better, but global progress in healthcare, that would grind to a halt. Health belongs to everyone, and we need a unified language that ensures a doctor in New York, a nurse in Bangalore, and a surgeon in Australia can all understand one another. It prevents errors in the treatment, speeds up medical breakthroughs, and allows a discovery in New York to save a life in far Kolkata. This is why, despite its complexity, the centuries-old Greek and Latin medical terminology remains untouched and will likely never change. The reality today then, when a patient in India is given saline, they probably have no idea about the term that comes from Latin salinus, means salt. When Anushka's mother worries about her daughter's hemoglobin levels, she unknowingly speaks a mixture of Greek and Latin. Homeo, Greek haima, means blood, and globin, Latin globus, means sphere, like a football. The very molecule that delivers oxygen to Anushka's brain is shaped like a tiny sphere, hence the name hemoglobin. Even thalassemia, a modern medical condition, owes its name to ancient Greek. Thalassa in Greek means sea, haima in Greek means blood. Named because the disorder was first observed in children around Mediterranean Sea. Despite being discovered in the 20th century, American physician George Whipple deliberately chose a Greek name instead of giving an English one to honor the ancient medical Greek traditions. The pattern repeats itself. Jaundice is known to the doctors as hepatitis. Greek of liver is hepato. The meaning of tumor is a lump or swelling. In Proto-Indo-European language, tu means to swell. Due to this language mess, we misunderstand tumor as a cancer. Not true. In fact, I have written an entire research article clarifying this very misconception. Link below. As a matter of fact, mosquito bite swelling is technically a tumor too. The solution? Medical language is complex, especially for lay persons. So is legal English and high-profile geography. It is not going to change in near future. So instead of waiting for a simpler system, talk to your doctor, ask questions, and educate yourself. The more you understand your diagnosis, the easier it becomes to choose the right treatment for yourself. Knowledge really is the power. Take care. That's all today. See you soon with another research article.